These are the people who are on it. Nothing yet.
Pluto DeFranco promotion.
Oh my God, people should be letting their kids do these meetings because they're so silly.
Okay.
Oh, we'll be getting started in a few minutes.
Oh.
Good evening, everyone. Welcome to the Metro YMCA of the Oranges presentation on the safe reopening of day camp programs. My name is Valerie Beck, and I'm a registered nurse. I will be one of several speakers that you will hear from today. During this presentation, we will cover the measures we've adopted to ensure a safe environment for both campers and staff during COVID-19. This includes preparing the camp environment, new health and safety measures, cleaning and disinfecting, and then we'll have some time at the end to take questions. Throughout the presentation, all viewers will remain on mute. Please feel free to submit questions through the chat. The presentation will be recorded and made available for those who would like to view this at a later time. As I mentioned, I'm Valerie Beck, and in addition to helping develop the health and safety measures for camp, I've also served as the health coordinator for emergency childcare services that opened back in April. Tonight you will hear from Brian Schaefer, who is our Vice President of Strategic Initiatives. He will cover cleaning and disinfecting. And then you'll hear from Joanne Brown, who is the Associate Executive Director of the West Essex YMCA. She will cover the question and answer session. We're also joined by several camp directors from all 7 of our YMCA locations, and you may hear from them during the Q&A. So to say our organization is committed to ensuring the health and safety of our children and staff is really an understatement. We have a team of experienced camp professionals that have been working alongside our senior leadership and human resources teams to develop guidelines over the past 2 months. Our new policies and procedures are based on guidelines set forth by the CDC, the American Camp Association, and the New Jersey Health Department. It is our commitment to ensure the most recent measures are in place at all times. If and when these guidelines change, we will be certain to take action and inform our families and staff immediately. Masks. So staff and campers will not be required to wear masks when outdoors while in groups. When social distancing between groups is not possible, campers and staff will be required to wear masks. When indoors, all YMCA staff will be required to wear masks. Campers will not be required to wear masks indoors while in their groups unless social distancing cannot be maintained. Individuals will not be required to wear masks if doing so will inhibit the individual's health and or if the individual is in water. Physical distancing or social distancing. So field trips, assemblies, large meetings, and performances are prohibited. Indoor swimming will be prohibited and may be reevaluated at a later date pending on authorization from the health department. We will cancel or modify activities where children are likely to be in close contact. Camps will minimize group sizes and movement between groups. The staff will assist and remain with one group. Groups will remain together throughout the day and will not be combined. As feasible, the same groups will be maintained from day to day. Sharing of supplies, equipment, food, and other high-touch items will be strictly limited. And finally, visitors will not be permitted to enter the camp during operating hours, with the exception of emergency or law enforcement personnel in their official capacity. Drop-off and pickup. So children will be dropped off at the designated area where they will be screened for symptoms. Daily temperature and symptom checks of staff and children will be done upon entry. Temperature may not exceed 100.4 degrees Fahrenheit. Parents will not have access to the facility or areas beyond the designated drop-off. Drop-off and pickup times may be staggered to avoid a large number of people congregating outside the facility or designate drop-off area. Children and staff must wash their hands or use sanitizer upon arrival. Staff will meet children as they are dropped off and escort them to the group. Parents and guardians will be asked the following questions. Have any medications been used to lower your child's temperature? Is your child experiencing symptoms related to COVID, such as fever, chills, cough, shortness of breath, fatigue, muscle or body aches, headache, new loss of smell or taste, sore throat, congestion or runny nose, nausea, vomiting, or diarrhea? Has your child been complaining of a body rash? Have you or your child been in close contact with anyone diagnosed with COVID in the past 14 days? And finally, does anyone in your household have symptoms of respiratory illness, which is fever, cough, shortness of breath? Exclusion from camp. So staff or children with a fever of 100.4 or higher, cough or shortness of breath will not enter camp. If a child or staff member develops symptoms of COVID while at camp, we will have a person move them to a separate area of the camp, and then we will ask the child to leave camp. If the camp learns of a COVID-19 positive case, they will contact the health department for guidance. If a staff member or child has symptoms of COVID or in close contact of someone with COVID, they can return to camp if they have been symptom-free for 72 hours. If an individual is diagnosed with COVID-19, they must remain out of the program for 10 days after the onset of the first symptoms. And Brian Schaefer is going to talk about cleaning and disinfecting.
Thanks, Val, and good evening to all of our families. As mentioned earlier, we've put a tremendous amount of effort into developing standards for a safe camp environment this summer, and a critical piece to this is cleaning and disinfecting. So we're going to be cleaning and disinfecting more than you've ever seen before. We're going to be using hospital-grade EPA-certified disinfectants that not only are effective against COVID-19, but are also safe to use around children. We're also investing in additional cleaning technology, including portable UV carts and portable electrostatic sprayers, which you see in the picture here on the slide. And these are going to allow us to disinfect areas faster and more effectively. We'll be focused on high-touch surfaces such as restrooms, bottle fill stations, tabletops, doorknobs, hands-on items, faucet handles, and equipment and toys. Our staff will be cleaning throughout the day, including before and after the use of equipment. And in addition to that, we'll have cleaning crews conducting a more thorough cleaning during after hours, getting our facilities ready for the next day of camp. Next slide. We've implemented a check system for staff to use to make sure that they are cleaning and disinfecting frequently. Staff are going to be required to scan a QR code when they've completed an area. These QR codes will be located and posted throughout the facility and camp area. And this is going to allow us to monitor the frequency of cleaning and disinfecting. And we're also going to be conducting spot checks to ensure that the cleaning and disinfecting is in fact taking place and they're doing it appropriately. If there happens to be a suspected or confirmed case of COVID-19, we'll take the necessary steps to clean and disinfect all areas under the guidance of the health department. And for indoor spaces, in addition to the cleaning and disinfecting, we've made adjustments to increase the amount of outside air as recommended by the CDC. Next slide. I want to talk for a moment about hand washing, because this is going to be another key piece to maintaining a safe environment for both our campers and staff. We're going to have our campers and staff hand wash upon entry and throughout the day. We'll have hand wash stations or hand sanitizer dispensers set up throughout camp where sinks may not be available. You might see these 5-gallon buckets you'll see that there's a spigot attached. These will be filled with clean water. There will be hand soap available at these stations. And this will allow for hand washing throughout camp. We'll also have gallon jugs of hand sanitizer with pump dispensers attached to them. You'll see that. Those located throughout camp areas. We're also providing counselors or our staff with small spray bottles that will be filled with liquid hand sanitizer that they will keep on them at all times. And this will allow them to hand sanitize on the go. They'll be able to hand sanitize their own hands as well as campers' hands. And just before I hand it over to Joanne Brown, who's going to talk about opening preparations, for those of you who have been working from home and going a little crazy with kids at home, you're not alone. We're in the same boat. I have a 7-year-old and a 5-year-old that will be attending camp on July 6th. So believe me when I tell you, we're going to do everything possible to make sure this summer is safe and enjoyable for all. And we're very excited to get our kids back to camp. And now I'm going to hand it over to Joanne Brown, who is going to talk about opening preparations briefly, and then also she's going to guide us through the Q&A.
Thanks, Brian. And once again, good evening to everyone. It's wonderful to see so much interest in this webinar tonight. Very crucial that all of our families are informed and up to date before we start camp. So as you've heard from Brian and Val, we have been very focused on the preparations to open camp and to open camp safely. There's really 3 components to it. We have been really working on the staff side of things. So there is a number of virtual trainings that they'll be required to take prior to coming back to work, as well as on-site training to do with the personal protective equipment, the cleaning and disinfecting that you just heard about, and also implementing the social distancing and the additional health and safety procedures for the campers. We have also been working diligently over the last few months to make sure that we're well stocked with those cleaning supplies and the equipment that we're going to need for the summer, and just to ensure that that is readily available and accessible to our staff. So I don't want to say that we've been stockpiling, but we've been stockpiling, we've been getting ready, and we are very much prepared with gloves, paper towels, soap, hand sanitizer, and the cleaning solutions that we need. The other area that our camp directors and staff have been very much focused on, and this has been a little bit of a moving target for us. There have been some changes that we have had to adapt to. And you heard some of those things mentioned already, but making sure that our daily activity schedules meet those health and safety needs, and the games and activities that we are implementing are permitted, and that we're also building in time for the frequent hand washing that is going to be required in between activities, as well as assigning additional staff to support cleaning and other sanitizing requirements. So pleased to have a number of colleagues from our other YMCA branches join me this evening to answer your camp questions. So to those who submitted questions when you registered for the webinar, thank you very much. We're going to actually start off with a few of those questions that came up. And just a reminder that you can use the chat function to submit any other questions that you may have that may have popped into your head as the webinar has been happening. So just remember, we're focused on health and safety, and there may be some questions that are very specific to your child or your child's camp program. So I really would strongly recommend reaching out to the director of the camp or one of these folks at the at your particular branch to get any additional information that you need. I'm going to start off with a question that we received from the registration. And I am going to direct this to Lisa Schaefer from our Wayne YMCA. And we had a couple of families ask about whether we would be requiring our staff to get tested for COVID-19.
Hi, everybody. I'm Lisa Schaefer from the Wayne YMCA. So testing the staff is not a part of the protocols that were set by the Department of Health for camp. So for the staff, we're going to focus on the same daily check-ins that we do for the kids with the temperature checks and the safety checks when they come in, and staff are informed that if they're not feeling well, to stay home for the day, and then they cannot return to work until they're feeling better.
Great. Thanks, Lisa. Another question that came up was, and I'm going to send this to Leah Green from the South Mountain YMCA. What can families do at home to help keep camp safer for kids and staff?
Hi, everybody. From South Mountain and East Orange branches. First of all, let them know that we are so excited to see them return back to camp. They're going to meet some amazing staff members and make lots of new friends. Try to get them comfortable with wearing their masks, and take the time to talk to them about the processes and the basics of what we're doing to ensure the safety and cleanliness of our sites, and encourage them that they're part of that process. Be a part of the team. Have that combo now that there's no trips and possibly no swimming. However, they're going to have lots of fun. Our candidates are working tirelessly to enhance our activities and what we're doing every day. And then ask them about their concerns and try to make them feel as comfortable as possible. If you do receive your FAQs from your prospective director, share the names of your staff with them so they know who to expect when they see them. And lastly, they're gonna have some fun, and we're excited again to see them. Thank you, guys.
Great, thank you, Leah. Another question that has come up a lot, and I know we touched on it, but I think it bears repeating, is around wearing masks. So I'm going to ask Carolyn Koch from Fairview Lake YMCA Blue Mountain Day Camp just to talk a little bit about just a little clarification on wearing the masks.
Hi, everybody. Thank you, Joanne. I am from Blue Mountain Day Camp with Fairview Lake YMCA, and wearing the masks, Leah had a really great suggestion, really get your children comfortable with wearing the masks. I know that really it's not ideal ever to rain at camp, but in the event that we do have to go indoors, only our staff will be required to wear masks unless we cannot prevent that crossing of groups. So the times where you would actually see kids wearing the masks would be when the drop-off happens and we can't control the other drop-off that's happening at the same time. So we would encourage the kids to wear the masks. And any time that they actually have to get out of their little families of 10 to 20. And then at that case, it is for their safety. So most of them should be used to it by now, and the more we talk about it and the more we become comfortable with it, it actually will become common practice. But the staff will wear masks indoors.
Thank you, Carolyn. So there will be no requirement to wear masks when the kids are running around outside and participating in sports and activity. Another question that has come up is, I'm going to direct this to Mary Soto over at the Greater Bergen Y. What can be done to stop kids from interacting with each other too closely or touching each other? We know kids like to do that.
Thank you, everyone. Again, my name is Mary Soto, and I'm from the Greater Bergen County YMCA over in Hackensack. Basically, during the day. You know, as some of my other colleagues have said, we're really encouraging for our campers to know that they're part of their group community. So we're constantly just giving them friendly reminders as far as every branch has their own kind of reminder language that we use, but we remind them to stay in their bubble, hands apart, and that way we show the distance that they should be in between. And, you know, we just encourage them that in order to protect our family and our group and stay safe and healthy, we should definitely observe that social distance. So it's just friendly reminders throughout the day. You know, as some of my other colleagues have said, you know, this is a new normal. So, you know, it's something that once we get into a routine and we practice every day and we give the friendly reminders, after a while, it'll just be a daily routine that they'll have.
All right, thank you, Mary. She might have been a little bit difficult to hear, but basically we are just going to be encouraging the whole social distancing. It's, you know, something that's a teachable moment, and the staff will be, you know, reminding the children throughout the day about just maintaining a little bit of space in between each other. So we'll be doing that in a, you know, a child-friendly manner. Thanks, Mary.
Thank you.
So another question that has come up is about bathroom protocol. Do the kids need to wear their masks when they're inside and also using the restrooms? So I'm going to pass that back to Leah. Leah, can you answer that question for us?
Sorry, John, can you repeat that question one more time?
Sure. Well, it's about bathroom protocols, and if children are coming inside for the restrooms, should they wear their masks in those situations when social distancing is not possible?
So, like you said, if social distancing is not possible, then they will be required to kind of wear their mask en route to the bathroom. But most likely, we are going to travel as in our little family groups. And when we're in the bathroom, we're only with our own families. So when they're in the bathroom, they don't have to have their masks on. However, if they're walking past the group en route to the bathroom, then the encouragement of having masks will be made.
All right, thank you, Leah. Lisa, if you could just talk a little bit about these family groups that we've heard mentioned from a couple of the directors already. What does that exactly mean, and why are there times when they don't have to wear masks within the family group?
Sure. So the groups this summer are going to be a bit smaller than normal summers, and we're treating each group as a family. So your child's group, those are the children that they're going to be with all week. We're not going to commingle groups or switch groups throughout the week. So those will be the same children that they're with every single day for all activities, for lunch, everything. They're going to stay with that one group.
All right, and thank you, Lisa. I've got a question for Nurse Val. What if there's a situation, well, actually it's a two-part question for Nurse Val. Do we take temperatures multiple times during the day?
No, just in the morning at drop-off. Although if the child isn't feeling well, we will check the temperature at that time. But that's just drop off. Okay.
And what if, the second part to that question is, what if there is a suspected case that develops during the course of the day? What are the steps that we take, and how soon will we be notifying the parents?
So the child will be brought to a separate room, and we will check the child's temperature again. We will call you and have you come and, you know, pick your child up as soon as possible. Then we will clean the room. We will, I guess, inform the parents as soon as we can.
And we also have that responsibility to contact the Department of Health, right, Val?
Yes. We will the director of the camp will call the Department of Health, and they will direct us what to do.
Okay. So some of you may have noticed that we mentioned that in our playbook, but that is the protocol. There's not the Department of Health is involved at that point so that they can take into consideration, different aspects of the situation and make the, we have to follow their determination as to what to do. So if there was ever a suspected case, we would be talking with our Department of Health and following their guidance as to how to handle the situation. Thanks, Val. I have a question also just on a topic that as camp directors we're very familiar with, and I'm going to ask Carolyn to weigh in on this. It's regarding allergies. How are we going to manage allergies this summer with groups of children eating together?
So most of the facilities are peanut free, and I would encourage to continue that, but also with our social distancing, the way the kids will have to sit for lunches and with food, first of all, they are not going to be able to share their food as they may have done in the past, or maybe at lunchtime. It will be discouraged by counselors just because of safety protocol, as well as they're going to be sitting further apart. And sitting further apart will not allow that cross-contamination, but per usual, the protocol is that everybody will be notified of any type of allergies that the kids will have, and we will make sure that we keep the kids safe within that area, especially in peanuts and tree nuts and those high allergies that require an EpiPen and situations like that. Joanne, is that where you were going with this question?
Yes, thank you. As we do each year, we will be collecting all of that information prior to camp about whether your child has allergies or any medical conditions that we need to be aware of. And of course, if your child does have a food allergy or anything requiring medication, we will ask you to provide that medication with the physician's orders, and there will be permission to medicate paperwork required as well. So I have a question about whether as parents you would be allowed to tour the camp where the children will be attending. So I'm going to ask Eric Soda to talk about this one, answer this question. Can parents attend the building, tour of the camp, or come see the facilities?
Yeah, so staying in line with the CDC policies and New Jersey Department of Health policies, we just can't have any outside visitors at our camps this summer. If you really would like to have a visit, you can reach out to your camp director and see if there's a time after hours that can potentially be set up. But it's just not something we're really going to be able to facilitate this summer. Another option is we are working with some of our branches to facilitate online tours or virtual tours. So stay tuned for that. That may be coming up from some of our different branches.
Great, thanks, Eric. Another question about masks. I'll just answer this. Would our child bring a mask with them each day, or will a mask be provided? We ask that you send your child with a mask to camp each day. We will have some additional supplies if someone forgets their mask, but especially with children, the adult size masks aren't always a good fit. So please do pack that with your usual daily supplies for camp. And for those of you who are looking to understand what that packing list is, that would be something that you would contact your camp director for. And let me just check to see if I missed anything here. There was also a question about if you need to pick up your daughter early one day, would you still be able to go to the front desk into the YMCA? Lisa, can you handle that question since you're at a facility with a front desk?
Sure. So as of right now, the building is not going to be open. So we will, at Wayne, have designated times, and I'm sure at the other branches, for drop off and pick up. If for some reason you need to pick up your child early for doctor's appointment, something like that, that is something that you would have to notify your camp director about ahead of time, so we can make the appropriate accommodations to make sure that you can pick up your child early if needed.
All right, great. Thank you, Lisa. There's a couple more medical related questions. I'm going to call on you, Val, for these. So regarding the time frame for having someone stay home if they were 72 hours separation after contact with a known COVID patient. Can you talk a little bit about that piece?
The child will have to stay home, like Joanne just said, for 72 hours from the time of the last symptom. Okay.
So we are looking for them to be symptom-free and then
For
plus
3
another
days
72 hours after that.
before they come back to camp.
Okay. And then, are we documenting temperatures and doing contact tracing?
We are not going to document temperatures. We will document if the child has a temperature of 100.4 or higher and they're asked not to come to camp for contact tracing purposes, but not the temperature if the temperature is normal.
And we also have, you know, our daily rosters and the groupings that the other staff have talked about. That is going to help us if we ever did need to do any sort of contact tracing. We can very easily identify the campers who are in a group and know that they have stayed within their family pod throughout their time at camp. All right. So thank you to the panel. We have reached the end of our questions. Oh, actually, I just see one more. Do children need to wear masks on the bus to camp? Carolyn nodding her head there. That would be a yes. So anytime you're in that indoor environment where social distancing is not possible, you would be required to wear a mask. Carolyn, did you want to add anything else just on the busing? Which doesn't apply to every camp, but for those that it does.
The busing does not apply to every camp, but if you are in a camp that is busing, the numbers are definitely minimized, and there will be assigned seating, and you will have to wear a mask for the duration of the bus ride unless it is a health concern, as Val said prior, and they will be sanitizing before and after. They get on and off the bus, and temperatures will be taken at the bus stops. Just to, you know, clear any questions, the same policies and procedures will be put in place on forever.
Great. Thanks, Carolyn.
Sure.
So thank you again to all the families who joined us this evening. We are going to put together some frequently asked questions along with a copy of the playbook if you haven't, our camp relaunch health and safety policies and guidelines. If you haven't had a chance to check that through, we're going to be putting together an email. We'll be sending it out to you all. And I just encourage you to reach out to your camp director for some of those specific questions, or if you still have any concerns that we weren't able to address this evening. So thank you very much. And we look forward to seeing you all at camp this summer.
Okay.
Thanks, everyone. Bye-bye.
Good night.
Good night. Bye.
All right, good night.
Bye.